Hey, it's Dr. Lowenstein, and today I thought I would try and start knocking out some of these questions that we get regarding various aspects of migraine surgery. And one question we get a lot is there a cure for migraines? Now, this is a very controversial question, okay, because everybody historically says, no, there's no cure for migraines, and it is what it is, and there's no cure for migraines. So I think it really depends on how you define cure for migraines, because there is a not small population of patients who have headache surgery, migraine surgery, that don't have headaches or migraines after their surgery. So if that's a cure for migraines, then I would take odds with the concept that that doesn't exist. In other words, for some people, there is a cure for migraines. Now, again, about half of our patients get a successful surgery with a significant decrease in their migraine pain. So they still have migraines, but they're not as severe, they're not as frequent, and almost all of the time they can be treated with medications, usually over-the-counter medications, and still sometimes maybe a triptan or two here and there. But again, half of our patients are like that, and all of those patients are very happy that they've had the surgery and would do it again. There's a very small subset of patients, about 5%, a little over 5%, that don't get a favorable response and probably wouldn't do the surgery again. But of the remaining patients, half of those are pain-free, headache-free, and I would argue have had their migraines cured. And about half of them are not that. They still have infrequent headaches, but they're in a much, much better place with less pain, less frequent pain, and treatable pain. And so I'm going to let you decide, based on that kind of information, whether or not a cure for migraine exists. But I'm loving taking care of patients and making their situation so much better.